Hi, my name is Gina and this is a closed basket weave ankle taping tutorial. This is Amanda Spencer. She's a soccer player and she just rolled her ankle playing soccer. So we need to tape it up in order to keep it stable while she's playing. So first we're going to use adhesive spray. This just helps the tape stick to her ankle better. You don't need a lot of it. A little goes a long way. Next, we want to apply heel and lace pads with skin lubricant on it. This allows for the tape not to blister her ankle to the top portion and the bottom portion. And then the skin lubricant allows it to stick better. And then you want to use pre-wrap. You want to use pre-wrap because this will allow less skin irritation from the tape. So you want to start like in the middle of the calf, below the belly, because you want to focus on the ankle, not the calf muscles. You want to avoid getting wrinkles in the pre-wrap because this could also cause blistering. And every time you go around, you want it to cover half of the piece of pre-wrap before it. You want to stop about midway up the foot as well. So then, you want to start applying tape. You want to put a piece of tape at the top, right at the top of the pre-wrap. And then you want to put another one halfway below it. Then you want to put a piece of tape right at the bottom of the pre-wrap. Then we do something called a stirrup. You come from the middle to the lateral portion of the foot because the most common mechanism of injury for an ankle sprain is an inversion sprain. So you want to pull the ankle outward and stop right at the top of the pre-wrap. Then you want to do what's called a C-cut, where you go from the middle, here, to lateral. And then you repeat these things 3 times. So, stirrup, C-cut, one more stirrup, and then one more C-cut. And then you start with your figure 8. You do 2 figure 8s. So you come here, go around the base of the heel, up, around, and tear. Do this twice. Around, up, around, base of the heel, up, and now we're going to perform the heel lock while maintaining the upright position of the foot through the entire process. I'm going to start in the middle. I'm going to go around the Achilles tendon, around the heel, up, over, tear. You want to do this twice. So, around the Achilles tendon, around the heel, up, around, and tear. Now you just want to close off any holes. So I'm just gonna going around. Till I get to the top. And that is how you do a closed basket weave ankle taping. So I've begun removing the tape from Amanda's ankle. You start here, you go down around the lateral malleolus, and then up this way, and then you finish it. And that's how you get a nice, smooth ankle tape off. This is how you perform an adductor strain wrap. You want a slight bend in this leg, this is the injured leg, with internal rotation, and you want the majority of the weight on the non-injured leg. You want to start mid-thigh and pull medial from lateral to medial. You want to go up the thigh, and you don't want to make it too tight. Once you get out to the hip flexor, you want to go around the back of the thigh, or back, lower back, and back down, still going from lateral to medial without getting rolls in the tape. You want to do that 2 times. And then finish off on the thigh. Can you hold that for me? And then you use these little clips and secure it off. All right. How you perform a hip spica wrap. You want the majority of the weight on the non-injured leg with a slight flexion in this knee. All right. This time you want to go from medial to lateral with a slight upward pull. And you want to start in the middle of the thigh. Once you get about up to the hip flexor, you want to go around the lower back. And perform the same thing. Do this about 2 or 3 times, depending on how big the individual is. And now we're just going to go around the thigh and then close it off. You want it to a slight upward pull because this is the injured area and you don't want him to easily pull back. How's it feel? Good? All right. This is how you perform a shoulder spica wrap. You want to make sure that the athlete is at least in a tank top. If they're a guy, they can have their shirt off. If they're a girl, in a sports bra, to make sure that the shoulder is open. You want them to start with the hurt shoulder hand on the lateral hip in a relaxed position. You want to go from lateral to medial in the middle of the arm. So then you want to take it, I'm going to go across the back of the shoulder, across the chest. You want to make sure it's not too high because you don't want it to choke them. Around the back, across here. And you want to repeat this process about 2 to 4 times. You can put that down. Make sure you're really encircling the tip of the shoulder. And I'll do it 3 times for you. And then just come around and finish it off. No, hold it. And then you want to clip it off. How does that feel for you? Good? All right. This This is how you perform a wrist taping. First, you want to apply adhesive spray so the tape sticks better.
I put them together.
Then you want to apply pre-wrap so that the tape doesn't irritate your skin. You want to start about a little less than midway up the arm and avoid getting wrinkles in the pre-wrap. Up to the top of the wrist. This is how you perform a basic wrist taping. Start here at the end of the pre-wrap, go around, and go halfway down. And you want to make sure you're not too tight because you don't want to cut off circulation in their hand. And you want to make sure their hand is out in this position. And you do this till you get to the end of the pre-wrap. Now, when you need to go up the hand, you go around the top of the palm. When you go this way, you want to pinch the tape, just because it's more comfortable. Down the palm, back around the top.
Hey guys.
And you want to do this about 2 to 3 times. Okay, that's how you do wrist taping.